So this is exactly from here to here divided into 3 segments. Number 1 segment, second segment and third segment. So lower 1/3 region, slightly downwards direction, where I try to find out if the sciatica problem is there. So that particular time the patient feel, ouch, I do have the pain. So that indicating, especially in this region, you just apply GB-30. So now we are just applying the GB-30 point. So just a distal to that region. This region also to be known as this entire region, Vanchun vicinity of the GB-30 area. Need not to worry, specific point you need to apply, but you just apply the entire region, that Vanchun around that 23 mm around that, to be known as a GB-30 area. So even you just apply this needle, after that you just do the stimulation. You just do like this, and then patient feels some kind of the twitching sensation. Yes, she got sensation, that means yes, we have applied, that's quite enough. Then we'll move on to some other point, right? So then what I told you, from the L4 to S3, L4 to S3, if the patient is complaining about the left side having the sciatica pain, then you just apply on the L4 to S3, yes, half tune lateral to the spine, that's called as a sacrum and then lumbar huato chiachi points, right? You just apply in this region below the caudal spinous process of the each vertebra, that would be better here. Then you just connect this point. In fact, in my clinical experience, I treated this and then this point, also quite enough to treat. Or you wanted to treat only these points, that also quite enough to treat for the obturator nerve. And also there is the quadrilaters nerve, and further it is the gluteal nerve, and then which we descending to the downwards direction, the popliteal nerve, the soleus nerve, all will be descending to the downwards direction. Now let me see 31, 30 is completed. Now 31 I wanted to select. Please give me a hand, then put it down. Where it touches, you just relax yourself, right? This shoulder is very straight, upright position. Where the middle finger is touches, this point to be known as a Feng Shui. This is GB-31. Yes, GB-31. From here is, give me your hand, where the middle finger it touches, this finger it touches here, that is GB-31 area, where the iliotibial band. Try to find out. So now you just give the pressure. Press this area. If this area is the very stiffness is there, spasticity is there, that time patient feels some kind of the soreness and pain in this region because the stiffness, right? That time what happen? You just use some of the points randomly, 1, 2, 3, to release that motor muscles. Yes. Sorry. You release that motor muscles. You just release this point by activating some of the points. Now coming to the 34th point, that means 33 point. I just take off this needle, then you just lie down in the straight position, please. This is as a prone position. She slept as a prone position. Now she is sleeping as a supine position, right? And try to find out. So this is the iliotibial band. This iliotibial band will become the one tendon. Then you can find this is a semi-membranous tendon. So this tendon and this tendon, this is the bicep femoris tendon, right? So this is one tendon, this is another tendon. This anterior to the bicep femoris tendon, and then this is the bicep femoris is the back, right? And this tendon to be known as a iliotibial tendon. You just find out the depression. This depression to be known as a GB-33, right? For related to the pain, if the patient is complaining, I do have the pain on this region, then don't treat on the other side, may not be required. Problem is because of this band is having the stiffness, which causing the problem. Hamstring muscle having the problem, which causing the pain on this region, or the runner syndrome. That's a, students will run or the athletics sports people will run, that causing the problem. So that time you just use this point, that is the GB33 point. You just insert the needle to this exactly on the hollow region, right? So hopefully you can feel the pain, but partially. Then slowly ask them to bring down to the lower portion. Try to find out if the patient is feeling the pain. Then you just relax, because this much needle may not be required here, and then leave it. So in this way we can do the procedure that's called as a lateral knee pain can be treatable by activating the C Yang Kuan. C means is the knee, Yang means is the Fu, and then brightness, and then Kuan means is the gate, right? The lateral part of the knee gate we have opened that to treat for the many diseases. But however, this is the popliteal muscle, popliteal artery closer to that, but iliotibial, and then further there is the common peroneal nerve that also to be known as the fibular nerve will get open once we activate this point. Now coming to the next point, so that's called as a GB34. Please give me, it is the 40 mm or the 60 mm needle. Now please find out the proper location is very much essential, where this point is located. Zoom, you can see that exactly location, right? So now you touch to the lateral side. I just take off this needle, will not be required. We dispose this. Now we try to find out, touch this lateral side of the knee. Lateral side of the knee. Once you touches, you can find the bone, prominent bone. How there is a styloid process is there. Likewise, you touch and feel the bone. That bone to be known as a head of the fibula. That bone to be known as a head of the fibula. Where you should touch, not on this exactly on the knee region, just distal to the knee. You touch, you feel the bone. How on the cervical region, we wanted to find out the C7. We touch and prominently we find out the C7 bone. Similar way, you touch and feel, yes, that bone to be known as a head of the fibula. Now where this point is located, anterior and inferior to the head of the fibula. But anterior I found it. Yes, this is the anterior. So this is the head of the fibula. Now anterior I just selected. Then inferior. Inferior means nearly half chone to one chone below to that inferior border of the fibula. This point is located. This point to be known as a GB34. GB34 is the most powerful point, but in fact this point to be known as a influential point for the bone and then cartilages, especially for the muscle and tendons, especially for the muscle, hard muscles and then fleshes to be taken place. Further deep. So it's not more than this. So more than this you cannot do the insertion, because that gets the damage of the tibial nerve sometimes, but you can use it maximum 30 to 40, 50, 60 mm needle can be inserted on that region. So once we do this, because it is the command point, it is the influential point, that is specific tissue, anywhere the muscle related problem, anywhere this is the interosseous muscles, this is the biceps muscles, or something related to the triceps muscles, or the masseter muscles, or the mimetic muscles, anywhere having the problem. So that time you are using this point, but this slowly will develop and regulate the build up to that muscles. So therefore wherever the flaccidity is there, or wherever there is a spasticity is there, both to be regulated by activating this point. But generally it is along with your treatment, you just add up this point is good. Number one. Number two is, why is it so important? Because GB34 is equivalent to the Xianggu. Xianggu is stomach 43. Stomach 43 and then is the grandmother point. This GB34 is the grandson point. This point is the earth point. This point point is the wood point, but joining together, that means is the GB34 is all related to the sinews and then cartilages, and then of course is the ligament and tendons, whereas in this stomach 43 is useful to treat for all the fleshes in our body, especially the smooth muscles, epithelial muscles, and also there is a cardiac muscles also treatable by activating some of the points this. But at the same time, what time it is advisable to use? What is the organ clock timing of the gallbladder? Is that 12 midnight? 12 midnight can be treatable this, or the morning 12 o'clock will be advisable, because already time is 12 o'clock, maximum energy is there. But that's the reason this is the grand sun point, it is a sedative point, it is the depletion point. So therefore you just apply the needle in the sedative way. 12 o'clock midnight you just apply. If it is not possible at 12 o'clock, this is stomach 43 is the morning, is 8 a.m. the morning time, morning 8 o'clock having the good energy. But when the stomach is required, the energy at 8 p.m. is required. Use this point as a 12 midnight, or you can use at the evening 8 p.m. would be preferable to treat by this point. If it is not possible, then anytime you can apply the needle, that always is good. So hopefully this is for the day-to-day clinical practice and known and unknown cases of the knee pain, the posterior knee pain, anterior knee pain, or the some kind of the popliteal pain, or the medial side of the knee pain, or this any kind of the muscles got affected, certainly you can use this point is good. Now coming to the GB35. 35, the point is Yangchio. So where this point is located, you come down 7 chun proximal to the tip of the lateral malleolus. I come from here, from the toe, from the, that means the lateral malleolus, 3 chun, again it is 3 chun. From here to here, how many chun? From here to here, how many chun? 16 chun. From here to here, how many chun? 13 chun. From here to here, how many chun? 19 chun is the proportional measurement. But you just select from here to here is how many chun? 16 chun. This is how many chun? This is 8 chun. Then 7 chun I wanted to select. From here, 7 chun. 7 chun proximal to the lateral malleolus, and then 1 finger breadth anterior to the border of the fibula. 1 finger breadth anterior to the border of the fibula. This point to be known as a GB35. Apply somebody. GB35. See, now you applied, but it's my advice is for you, you just apply GB35, is you just apply perpendicular, because lot of flushes are there on that region, because you are applying to the extensor hallucis, extensor digitorum muscles, because these muscles are, so many muscles are existing. Behind that, this is a soleus muscle. Behind that, that is the gastrocnemius muscle. Anterior to this is the peroneus muscles. These muscles called as a peroneus longus muscle. These muscles to be known as a peroneus brevis muscle. These muscles to be known as a ATM muscles, anterior tibialis muscles. And these muscles to be known as a soleus muscles again. So hopefully we understand these muscles are too much muscles are there, you just apply on the this is the peroneus longus muscles. Then you just come down, this you applied. Then the next point to be known as a GB36 is the posterior border of the fibula. That point is located, you just apply here, the posterior border of the fibula, this GB36. Both the points are really great point, because GB35 is the C cleft point for the gallbladder. GB36 is the C cleft point for the Yang Wei Mai meridian. Extraordinary meridian. Both the points are, according to my clinical experience, if the patient is complaining, I do have the pain on the lateral position, or the ribs related problem, shoulder related, one side temporal region disorders, then you can use the C cleft. Both the points you just activate regulated, that would be really better, because both the meridians having the C cleft point, emergency controlling point to regulate that particular meridian, because anything the blood stagnation is there, blood flow is improper, that time to free flow that certainly we can use this point. Now coming to the next point is GB37 is the most imperative point for the day-to-day clinical practice from here to here. So this is half you can select, this is 1 chun proximal to this, 3 chun, 4 chun above, and then plus 5 chun above. 5 chun above, you just apply this on the anterior border of the fibula. This called as a Quang Ming. Yes, Quang Ming. Quang means again it is the eyes, and then Ming means is the brightness. That means for the brightness of the eyes can be treatable by activating this point. What conditions? Anything the vision related problem. We ask them to give the pressure on this region every now and then, but certainly we have the great impact that you just mark it and then ask them to, while sitting position, you give the pressure like a gear. Every day 2 minutes you just give the pressure, that will be really good. Hopefully you understand GB37, and then GB38 is the Yang Fu. GB38 is the Yang Fu. Isko thoda kareeb lekar aa. Yes. GB37, GB38, 8 is the Yang Fu. You remember only few points, you just focus and really this will be helpful. GB37 is completed, GB38 is 3 chun plus 1 chun proximal, then GB38 is the Yang Fu. Yang Fu is equivalent to the which condition? UB65 is the Shugu. This is the command point. This is the command point, and at the same time it is the sun point. This is the grand sun point. This is the sun point of the gallbladder. Whatever the excessive energy is accumulated, the bile is stored more in the gallbladder to dispel that or to scatter that or to release that energy. That time we use this, but GB38 is equivalent to the Chungsu, that is angio 3. This is the fire point. Both the conditions are the same conditions, can be treatable. Now GB37 is the sun point. Now you just fold it. We try to find out the one proper location which is a day-to-day clinical practice to treat for the brain and then marrow related disorders. So we try to find out the location. So normally there is a lot of theories are there here, but I'll try to tell you which is the proper location. The tip of the lateral malleolus, from the tip 3 chun proximal to this, approximately you can place it 3 chun proximal to this region. So accurately this is the point, but midway between the peroneus longus, peroneus brevis tendon, in between these two depressions, this point is located. How to touch and then feel, not required to palpate, oh this, that and all. You just press smoothly as a feather touch. You touch, you can find the two tendons. You touch, you can find the two tendons. In the two tendons, you touch and feel here. Two tendons, you can feel it. Two tendons in between the depression. How to understand? You can find here also, which I told you on the other day. So maybe this is as a, you do it like this and you can find the two tendons. You can find the two tendons, flexor carpi radialis and palmaris longus tendon. In between the two tendons, depression, which point is located on the hand? P6. In the similar way, 3 chun proximal to this region, midway between the two tendons, in the center of the leg. Two tendons in the depression you just treat. So this will be useful to treat for the bone marrow related disorders. Bone marrow is the two types in normally. One is the red bone marrow, the other one is the yellow bone marrow. Yellow bone marrow is really good to treat for the fat related tissues and the fat related cells to be regulated. Red bone marrow is useful to release the red blood cells, white blood corpuscles, and also the platelets and thrombocytes thrombocytes can be released. By the way, the red and blood, both the cells can be released with the marrow exactly inside the bone. So that's called as the raw cells to be distributed. So first it prepare the raw cells inside the medulla of the bone where the periosteum, under that periosteum bone marrow is existing. Through that bone marrow, what it produces? Stem cells it produces. Through the stem cells it produces the good quality of the cells which is required. That's called as the mature cells. Right blood RBCs, WBCs and platelets all to be released by activating this point. Yes, all the blood related disorders can be treatable by activating this point. So hopefully in this way we just apply to the Swan Chung GB39. GB39, 3 chun proximal to the C. Now this condition, known and unknown case of the anything, the immunity deficiency which causing the much more problem to you and me and all. So in that way to elevate the immunity, so this will be really helpful. At the same time, once we do it this, and slowly the cancerous cells, even the white blood corpuscles has been gone to the 1 lakh, 1.5 lakh cells, which is required less than 11,000. But how many cells are required? If it is more also, that can bring down. If it is less also, that can be increased the white blood corpuscles by activating the same. So hopefully this is all the blood deficiency related disorders, and also to increase the blood quality. The kidneys are essential to regulate the red blood corpuscles. The spleen is required for the white blood corpuscles in order to do for everything. But this is the bone marrow is very much crucial. The humerus bone, there is the femur bone, fibula bone, and then shin bone. Then further there is the radius bone, ulnar bone. Each and every this kind of the bones having the bone marrow inside the bone marrow. So once will develop, but definitely this having the great impact to treat for the many more diseases. By the way, this point is good point to treat for the neck related disorders, shoulder related disorders. Of course is the unilateral headache or unilateral related to the ribs related problem, also distal point by using this point. Now coming to the most important point, Chicxo, that is the GB40. So GB40, how to do that procedure? Marker. You just make it this as a, one is the lateral malleolus. From the below the lateral malleolus you mark it, and then the anterior to the lateral malleus you put the vertical line. If the two line where it meets, that point to be known as a GB40. This is the horizontal line. This is the horizontal line. And this is the vertical line anterior to the GB, anterior to the lateral malleolus. The meeting point to be known as a GB40. Please apply somebody. GB40. Yes, perpendicular towards the energy you just apply. That would be better. Yeah. Yes, GB41 I'll finish shortly, but you can find out GB41 you stretch like this. You don't apply like this, but you stretch. You can find the extensor hallucis digital tendon. Extensor? Yeah, hallucis tendon or extensor digital tendon. In the depression, this point is GB31, GB41. Right. So in this way you just activate, or you wanted to sedate, you can sedate in this way. This is the source point. This is the in-house point, or this is the horary point of the gallbladder. Right. Whenever the patient is complaining, the gallbladder is deficiency from the morning to till now 3-4 hours I have taught you, but 4 hours history what I told you to treat for the 4 hours journey. But you can use the single point. GB41 is the Sulenchi, will be useful to treat for all the GB related disorders, all the gallbladder related disorders. Certainly you can use it once you can activate this specific point. Such a great information or great knowledge or the great mileage by using this point. Now coming to the Divohui. Divohui is the GB42, one chun proximal to the web margin, midway between the fourth and then pinky toe. From here, one chun proximal to this region in the depression, this point is located. Please, you just apply GB43, 41, 42. This is Divohui. The Chinese names are more predominant than this, simple names. But however, you just apply now for Chachi. Chachi means which Chachi? तुम्हारी चाची? हाँ, चाची है यहाँ पे, ठीक है. XI, Siaxi. Siaxi, the pronunciation to be known as a Chiachi, right? चाची को याद रखना, ठीक है. चाची इधर है, लगाओ पे. You just apply here half chun proximal to the web margin. This is the coincidence point, also to be known as a Pa Feng. Pa means is the 8, Feng means is the wind point. But however, how the knee thing ST44 is there, and then likewise this point also, and then GB43, Chiachi. This is the mother point of the gallbladder. Then the grandmother point of the gallbladder, you just use this point. So you just apply this needle and then, yes, this is GB40, GB44 is the grandmother point of the gallbladder meridian, which is also connecting to the all the sense organ to be treatable by activating the GB44. The vision problem, lips problem, nose issues and ear related problem, and further the tongue related diseases can be treatable by using the GB44. By the way, GB44 is the command point which is connecting to the Sanjian. Sanjian is the gallbladder. Sanjian is the Li3. So in this is the gallbladder 44 is meeting point. So this is equivalent point is Li3. When the Li3 having the stagnation, when the large intestine is not supporting the energy to the gallbladder, so that time we can use this point. Either any one point would be advisable. By the way, GB44 is the last exit point of the gallbladder meridian. Thank you. We'll wind up now. Later we will see you in the afternoon class.